psychotic depressions. Now, I'm just going to spend a little bit of time on this, but I want to give you a clinical case. This woman came to see me. Actually, her husband brought her in, and she had had a postpartum psychosis. And she'd had her baby a year ago, and she has been continuously depressed and psychotic since then. Her psychotic symptoms were delusions, and her delusion was that she was in hell, and that she was damned, and that she'd been sent to hell. And the fact that one psychiatrist after the next said, "You're mentally ill," she said, "This is the way that Satan is punishing me." And so her husband was and she didn't want to have anything to do with her baby. This is one of the bad things about postpartum depression in general, is even loving mothers oftentimes they get so consumed with the depression that they don't interact as much with their babies. But she didn't want to have anything to do with her baby. And so her husband brought her in for probably not just second, maybe third or fourth opinion. She'd been in treatment, though, for about a year with a psychiatrist, okay, and treated with various medicines. This guy was extraordinarily conscientious. He realized that their baby was at grave risk, so he hired a nanny to come in. He took off lots of time from work, and basically she was having nothing to do at all with the baby. And so he brought her in, and first off, he was very conscientious. He he had a list of all her medications, the doses, how long she'd taken them, and all this kind of stuff. And so I was doing the interview with her, and she had psychotic postpartum depression. And so and with psychotic depressions, one of the biggest problems is real high suicide rates, okay? So I asked her about suicide, and she says, "What are you talking about? I'm already dead. Why would I kill myself?" Okay? I mean, she was completely serious, okay? So I got to the end of the interview, and I looked at this sheet of paper, and I looked at the medications that were given, and guess what? Okay, you see what the outcome is if you just treat with antidepressants or just antipsychotics? Not very good. Every textbook of psychiatry says the same thing. You've got to combine them together, or it just doesn't work. And in 1 year, she had never been given both drugs at the same time. And I just was really pissed. And so I said, although I tried to be very professional, I said, "Mr. So-and-so and Ms. So-and-so, listen, here's the deal. I think this is a postpartum depression, and you have psychotic symptoms." And she rolls her eyes like, "Okay, here we go again. I don't believe this. This is a bunch of baloney." And I said, "Well, I know you don't believe me, but this is my professional opinion. And furthermore, and gosh, there's lots of different ways to treat people. Nobody's got a monopoly on the truth about, except there are a few exceptions, and I think this was an exception. I said, my opinion is you have not been getting the right treatment. And this is not just a personal opinion, but it's in every psychiatric textbook. And there really are only two treatments for this kind of depression. And one is combined antidepressants and antipsychotics. The other is ECT. And so I said, I really recommend that you go back to your psychiatrist and share this information. And they did. And 3 days later, I got a call from the husband saying her psychiatrist fired her. I'm like, "Oh, you're going to go see somebody else for an opinion? Then you're out of here. If you don't trust me, forget it." You believe that? What?
Isn't that abandonment?
I consider that to be abandonment. Yeah. And so the guy called me up and he says, "What should I do?" And I said, "Okay." So one of my best friends, psychiatrist, and I said, "Here, call this guy up, and if I get your permission, I'll talk to him." Well, she was in the hospital the next day, and 2 days later she started ECT. And I got a call from her about maybe 4 months after all this happened. And she called me up and she said, "I just want to tell you something. I'm totally okay." She said, thank you. Your psychiatrist friend saved my life." And she went on actually to write a magazine article about her experience with ECT. Yeah, so anyway, and this is not perfect either. 75%, it's certainly not 100%. ECT is the best treatment for psychotic depressions. And here's where I want to talk about ECT a little bit. ECT basically is used for just a handful of conditions. Okay, one is untreatable severe depression or mania, when nothing else works. ECT works. It's a treatment of last resort, okay? In her case, it may not be the treatment of last resort because there are two conditions where it may come up closer to the top. One of these is where you have somebody who is very, very suicidal, okay? The second is with severe depression and they're not eating, and they will starve to death. Now, I'm going to show you an ECT treatment here in just a minute. I guess when I was working at Kaiser, of course, I saw lots of people then, many more per year than private practice, but about one time a year, I'd have one of my patients go in the hospital and get ECT. And probably in my career, I've had maybe 12 people get ECT. And every single one of them was uneasy about it, and every single one of them came out of the hospital saying, "Thank God it saved my life." Now, my first experience with ECT was not as a therapist. It was I was an orderly at a state hospital when I was in college. This was in the 1960s. And the first day I got there, they said, "Mr. Preston, in addition to mopping floors and making beds, you also are going to assist with ECT. And by the way, it's Monday morning. We do it Monday, Wednesday, Friday. That's the first thing you're going to do here." And I remember the guy's name was Mr. Bueno. He was like the lead orderly. You know, he says, "Go with him. He'll show you what to do." Now, I'm just going to tell you the story because, I'm a teacher and I get to show off my stories. Okay, but this is just really, it was just, it was scary to me. Okay, so here are my two experiences. One is they would, I'm not making any of this up. They would line up patients, and usually they have 5 or 6 patients getting ECT at one time. And they'd be sitting in a row. Y'all kind of remind me. They're sitting against the wall out there. And so one job that you would do is you would be the guy who stood out there and tried to reassure people. Given the fact that I had a course in abnormal psychology, obviously I was a prime candidate for doing this. And what would happen is they'd bring these people out on a gurney after the ECT, and they'd be going, picking at the air, and we're supposed to be saying, "No, really, trust me, I'm a psychology major. It's going to be okay." I mean, it was stupid. It was inhumane. Really, they bring them right out in front of these people. God. Okay. The second thing is you would go sit with these people after the ECT, and they'd be delirious. I mean, they're picking at the air and they're confused, and after about 20 minutes they kind of sort of come to, and then you get them up and you take them down to eat breakfast, and usually the severe disorientation would be gone after a few hours. Now they would continue to have memory problems, but they were okay after that. And then the third thing is to actually assist with ECT. And so what you did here, we rotated, and there were 3 of us, big guys at a time, and one of us would hold up the electrodes on the person's head. It's like a big rubber band. You put electrode jelly on there and hold it up here and hold it, and you put this thing on their mouth so they didn't bite their tongue, and hold their head back so they didn't aspirate, and then the other 2 guys would lay on top of the person because they'd had these whopping big seizures. And this is stuff like One Flew Over the Cuckoo's Nest. Okay, the thing that to this day, when people say shock treatment, they've seen it in movies and they go, "Oh my God, it's horrible." So I was interested, but I was kind of terrified also because it was scary to see this. But here's the flip side, okay, and then we'll look at the video. There was this woman on my ward, and she was probably in her mid-60s or late 60s. She was emaciated. She was psychotically depressed. She was not sleeping at all. And all day she would go, And so they said, "Okay, look, we're going to have to tube feed her or give her ECT." They tried for a while to give her medication, didn't do anything, okay? And she's going to starve to death. So they gave her ECT. And after one treatment, she stopped the rocking and she started talking. Now, she wasn't over her depression yet, but this transformation, absolutely astounding. So here, there's this thing that, from the outside looked horrific, and yet it's like, holy mackerel, and it saves people's lives, okay? So anyway, let me go ahead and show you this, let me see here, treatment. And since then, they have changed dramatically. They've changed how they give ECT. That you'll see that they give a general anesthetic, so somebody is completely unconscious. They give a very powerful muscle relaxant, so they don't jerk. They may just do a little bit of this kind of thing. No grand mal. Well, they actually, in brain-wise, have a grand mal seizure, but they're not. I mean, people sometimes would break a vertebrae or something, a rib or something. They were so severe. And they have an anesthesiologist there, as well as a treating physician, and so that the way it looks is vastly different, but it's still the same thing. Doctor, okay, hang on just a second. Make sure I get the right one.
Do you feel happy? The doctors think that you want to die. Is that true?
I want to die.
Is that true?
Mm-hmm.
Have you told this to your husband?
Yeah.
What does he think about it?
He thinks I'm kidding.
Why do you want to die?
Because I'm the devil.
What does it mean to be the devil?
It just means being really evil.
Have you done something wrong?
I never laughed. I never loved. I never forgave.
In your whole life, you never laughed or
Yeah,
loved?
I did laugh. I thought I loved.
But you don't feel that way now.
Just look at me.
What about you that's different?
Everything I smell.
You have a body odor?
Mm-hmm. My hair's falling out. I'm disgusting. I'm evil.
In fact, you think that you should be dead. Did you try to kill yourself? Did you really?
Yep.
Tell me about it.
Took a bunch of pills, aspirin,
When was this?
on Thanksgiving.
Electroconvulsive therapy is a very powerful way to change the mood of individuals who are very severely mood altered. In this treatment, patients put to sleep, and 30 seconds later is given a dose of a muscle relaxant.
Revitol is going in. Delayed reflex is gone.
Cuff is up.
Okay. White block is in.
Chin up.
The impedance is low. Okay.
At that point, electric current is passed between the electrodes in the head. And that takes anywhere from a half a second to 4 seconds.
Treat.
The individual will have a motor movement, what we call a grand mal convulsion. We're interested in that the seizure be of adequate duration, which is between 25 and 120 seconds, in order to be a good or effective treatment.
Mary, open your eyes. Treatment's all over with.
With the severe form of major depression with psychosis, and that Mary has.
Mary, open your eyes.
In that illness, medication is usually not very helpful. And so the best alternative is electroconvulsive therapy. do you remember about your depression?
The depression that I came in here with, I don't really remember much about.
Remember nothing about it?
Mm-mm. I do remember going home being in the hospital here and going home on Thanksgiving and taking a lot of aspirin. I remember that.
What happened on Thanksgiving?
I remember thinking I was the devil.
Yeah.
And taking aspirin, and then my son coming from my neighbor's house and coming into the bedroom, and then I remember feeling bad that I had done that because I didn't want to die and leave him. And then I told him to go tell his father that I had taken a bottle of aspirin, and then he brought me back to the hospital.
So you have been depressed.
Electrotherapy, or as it's sometimes called ECT, has a very important place in the treatment of certain depressions. It's not a panacea. It doesn't help everybody. It doesn't help everybody with depression. But by and large, it's probably still the single most effective treatment we have for severe depression.